Hey everyone, this is Dr. Ray from Bradford Family Chiropractic. I'm here with Isabella, our intern. We're going to be doing some quick active release techniques to see if we can help out with tennis elbow or generalized elbow pain. So the first technique we're going to do is one for this extensor component or the extensor wad of the forearm. So how we're going to do this is we're going to have the patient set up with their arms straight. We're going to have you extend that wrist back. I'm going to make my contact and I'm moving the hand around to actually find the moving muscles in the extensor compartment, and I can feel them moving under my finger. Now I'm going to make a nice, we'll call it a perpendicular contact with them. We're going to have the patient extend the hand back. Now for me, so you can see a better visualization, I'm going to put a little pressure on it, and I'm going to have the patient, we're going to close the hand for us slowly, and then we're going to bring the wrist all the way down. We're going to flex the wrist down as far as we can. Good. Now I'm going to take my hand, I'm going to move my contact down small amounts. We're going to make that same contact, and let's crush the hand and bring it down. Now, we're going to try about maybe 4 to 6 passes through here and crush the hand. So the things we want to be cautious of as a provider, we don't want this to be too pinchy and painful. So we're going to have good feedback with our patients so as we don't kind of irritate that muscle tissue. So that was for the extensor compartments. Next test we're going to do right now, or next treatment we're going to do right now is going to be for the tricep. So with the tricep, we're going to also start with the arm extended. Now, I'm just going to show you the medial head of the tricep, our connection. So we're going to start here. I'm going to make my hand contacts, my thumb across the distal portion of the tricep, and I'm going to put the pressure on with my other hand, and we're going to have that patient bring the hand in, and they're going to use the other hand to continue the movement. Good. Now I'm going to move it down a little bit here. I'm going to switch my hand so it opens up the space. So here's my contact against the tricep, and then we're going to bring the arm back and push it all the way back. Now I'm going to do passes through the lateral aspect of the triceps, and then we're going to do the same technique with our contact on the medial portion of the triceps. Good. So far we've gotten the extensor compartments, we've gotten the triceps, now we're going to move to the biceps. Biceps are going to be easily done. We're going to have the patient start with a little bicep contracture. Here's my contact across the biceps, the distal biceps. I'm going to put a nice perpendicular contact on that bicep. I'm going to put a little pressure into it, and now we're going to extend that arm down, and then we're going to bring the arm all the way back. Good. Now we'll try it again. We're going to bring that arm up. We make my contact here and extend the hand through. Good. That's not too painful?
No.
So again, these can be real pinchy, and here's my contact again if you can see it. And we're just going to extend the elbow and extend the arm. All right, so again, we've just covered some of the treatment options we have for a elbow pain, specifically maybe a tendonitis at the elbow, working primarily on the extensor compartment of the wrist and the elbow. We're going to add a little bit of triceps and a little bit of biceps to that as well. Again, Dr. Ray, Bradford Family Chiropractic with Isabella.